Welcome. I will be doing the concluding part of what we started last week: sudden cardiovascular death, presentation, and risk factors. You also talked about those on diuretics, probably because of the potassium also. I think it would be nice for us to know the presentation. Because it doesn't have real symptoms, how would they present? And with this, if somebody's potassium is low, how would the person also present?
Please. Cardiac arrest usually does not have any symptoms. People are just walking time bomb. Okay? They walk into the bank, they slump dead. They go to watch a football match, they slump dead.
Then they are home watching TV.
They're even sleeping.
So usually majority of the people don't have symptoms. But occasionally, sometimes just before it happens, you feel certain symptoms, but it's too late to do something. Suddenly you might just feel some chest discomfort, or you feel that your heart is fluttering and you faint, or you can't breathe, you are short-winded, or some people will even have nausea and vomiting, and boom, they collapse.
So how will they know?
So the point is, know your risk
Factors and your numbers.
Don't even wait for treatment because it's too late. Okay, when it happens, the recovery is not good. So prevention is better than cure. So we will emphasize the risk factors. When I see people, in my heart I say, this is a
and I think also, I think that is the point we should nip in the bud now. Yes. Those risk factors for our viewers and the preventive measures, so that people will know, look, he said this, I'm a ticking time bomb. I need to be able to do, because you, like you said, no symptom. So it's good for you to know.
Okay, so these are the risk factors, and these things are all preventable.
Okay.
Number one, high blood pressure.
So make sure you know your blood pressure.
Hypertension, because majority of the people with hypertension don't have symptoms. That is why it's called a silent killer. And hypertension is big time with African genes. We Africans have severe hypertension, and we don't have symptoms, and the hypertension is more severe. So you should know your number. You should know your blood pressure, and don't be fooled that you don't have symptoms. Okay. I have seen a young man, 30 years old, with a blood pressure of 220 over 120, no symptoms. It was just discovered by luck. And by the time he came to us, and we did ECG, terrible abnormal ECG, echocardiogram, severe left ventricular hypertrophy, 30-year-old. That was a working time bomb for either massive cerebral hemorrhage or heart attack. That's number one. Number two is diabetes. High blood sugar. You should be checked to make sure you don't have diabetes, because most people with diabetes will not have symptoms. Okay? Some people might even have symptoms they don't know. Frequent urination. They just think, that's right. So diabetes is important. And these things, as you can see, there are some lifestyle changes that can modify all this. But let's go through down the list, and then if we have time, we can talk about that. So one is diabetes. Number three is high cholesterol. High cholesterol can clog up your arteries and lead to heart attack and all that stuff. Number four is obesity. And when I see them, I know that. Men that are 6 months pregnant.
But I think that is part of wealth. They are doing well.
That is false premises, because that is actually, they need help. Those are people that can drop easily. You see men eating too much, drinking too much, thinking is fine. Every weekend, the suya and, all this eating. They think they're gonna their wealth is just to feed themselves. It's untimely death. And let me also say this: if you're a man and you have big tummy and you're having a lot of breast, I am trying to tell you that that is serious. Because the fat cell is not just storing fat energy. This fat cell is an endocrine organ. It manufactures estrogen. It manufactures some inflammatory factors. It manufactures some proteins that make you clot easily. That's why people that are obese can have a blood clot. You know that it is inflammatory condition. Obesity can lead to diabetes. Obesity leads to dementia, early, you know, loss of memory, you know, decreased sexual libido. Okay, so you know there's a diagram that shows the different hormones that fat cells produce, and all these things are bad stuff.
Wow.
Okay, so obesity. Now the next one is diet.
Okay.
The wrong diet. There are certain foods that are inflammatory. They cause disease. They cause, you know, atherosclerosis and all that stuff. People that, you know, eat things made with white flour. Some people, their breakfast is biscuit and mineral. Okay. People that eat bread and stew, that's all they eat. Okay. Chin chin, you know, cake, French fries, fried potato, Indomie, you know, pasta, all that. Okay. So those things, and then they're drinking soft drinks instead of drinking water. All right.
I think
So, and also when they drink, you know, their pap, they put 4 cubes of sugar there.
And milk.
Okay. All right. Or too much honey. All these things are poor diet. And the next one is exercise. You have to have exercise is more powerful than medicine for cardiovascular risk reduction. Exercise, like you can actually have a whole talk for 1 hour on the benefits of exercise.
I think that's what we need.
And I'm trying to tell you that. So exercise is important. Then for young people that smoke, smoking is a risk factor for heart attack, stroke, lung cancer, throat cancer, you know, name it. Smoking. And then finally, there are 8 things now we are talking about. Finally, sleep.
There's something that if you are sleeping, that is part of laziness.
No, please.
Lagosian says sleep 7 to 9 hours.
The recommendation, on a serious note, because I see people in my office and I feel sorry for them. The recommendation for normal sleep that we need as adults is 7 to 9 hours. There are some people in Lagos that go to bed at 11, they wake up at 4 a.m. to get ready for work, and then they get back. That is not a life.
They say that is normal. They even argue with you.
In other words, it's an abnormal normal.
Okay.
When you have abnormality for years, it becomes a normal thing. But that leads to lack of sleep, leads to increase in risk of diabetes, high blood pressure, obesity, a lot of things. Okay, decreased immunity. Some of these people, you know, decreased immunity will lead to increase in the risk of cancer. So sleep is so important.
Very.
And then sometimes these people are under a lot of stress, they are depressed, they are low spirited, you know. So all those things are health issues. So heart attack, by the way, is sudden cardiac arrest or cardiac arrest is not that, you know, sudden, because you've been carrying this pot belly for years. And then when it now shows up, you say it's sudden. No.
Yeah.
So it's awareness. You have to understand how to take care of your health. And in a place like Nigeria, where we don't really have resources, okay, when these things happen, people can't afford it. You have a stroke now, they admit you to ICU. Just an ICU deposit in Nigeria right now is about 2 to 4 million.
That's the one that's
by the time you stay there for 1 week, you might 11 million.
Yeah, 10 million plus.
So the same thing, heart attack. If you heart attack, coronary angiogram to run a tube to find out where the blockage is is at about 1 million. If you're going to have a stent, it's 4 million. Stent is a tube. You open the artery and you put a tube that area of blockage to keep it open. So people can't afford it. So your best bet is to take care of yourself.
The earlier the better.
Preventive measures. So I've given you 8 risk factors, and to manage each one of them, there are some lifestyle changes that you need to do first before you start adding medication. Because health is not just taking the drugs. And some of these drugs are very expensive. A lot of Nigerians can't afford quality health. Okay? So that's what I'm trying to tell everybody.
Okay, so Dr. Nwosu, you've talked so much about this, the symptoms, the presentation. So for the person at home now, and already knows about the predisposing factors, the risk factors, and suddenly begins to have this probably a tightening of the chest or something, what do you think the person can do? What are the measures the person should take? Sudden measures, that's number one.
Yeah. Okay.
That's number one. Then number two, within how many hours do you think the person can be managed before even getting to the nearest facility?
Okay, first of all, if you have any symptoms, please go to a doctor. Don't stay home.
Yeah.
If you're having some chest palpitation or tightness, or you can't breathe, go to a doctor. Okay, let's put it that way. Let's not manage it at home. Go and find a doctor. But the point I'm trying to make is take actions before you have symptoms.
Yeah.
Yes.
Take action. So
understand that aspect of taking action before you have symptoms. Somebody suddenly begins to tell you, okay, let's assume that the person is not even aware. There's no sign, there's no symptom, and somebody just comes and the person begins to say, I have this excruciating chest pain. I have this chest pain. So what should they do at that time before even going to the hospital?
Yeah, like first aid.
Okay.
Yes, first aid.
All right. First of all, if you're having chest pain, there are different types of chest pain,
yes,
and the treatment are different. Because chest pain could be from angina or heart attack. Chest pain could be because your heart is beating very fast. People with atrial fibrillation and the heart is racing. It could be chest pain. Chest pain could be because your blood pressure is very high and you're having aortic dissection. This big artery that carries blood from the heart can rupture.
You want to turn like
So this big artery that is, can rupture. Chest pain could be because you have a big clot sitting in your. So to start telling people what medication to take and no. So the point is this: if you're having any, because I don't know what the diagnosis is. If it looks like angina or heart attack, I can say take aspirin. But supposing it is rapid AFib. So yes, the important thing is this. Just believe me. The important thing is that let's hammer how to manage your risk factors. Yes. Don't wait until you have, and then on TV I'm trying to tell you how to manage it at home. No, because I could be wrong.
Yes, you're right.
I could be wrong. So I can't tell you if you have a chest pain, do this. So I can say if you have any of that, please go to the hospital. Because some people are having that. They try to wish it away. It's not my portion.
It's not my portion.
This, that,
spiritual attack.
So they stay home for 6 hours, 7 hours, whole day before they go. No, don't claim that it's not your portion. I'm a man of faith to just believe and pray, but go and see a doctor.
You made mention of aspirin just now. I'm coming to ask you something.
What's the role of aspirin?
Somebody has said they've been on aspirins for over 10 years.
Yeah,
yes.
Please, let's not go there. We don't have enough time for that.
Yeah.
Let's go back to the risk factors and see how people can take care of themselves at home.
Is it advisable for them to be on aspirin
for that long?
Is it advisable?
Low dose aspirin, 75 milligrams, sir.
Okay. Yes. Is it advisable?
It is. How do I put this?
You said let's not go
there. So what I'm trying to say is that is a topic. It depends on your risk profile. There are some people that will benefit. Aspirin is not for everybody.
That is exactly what I want.
Yes.
That's the point I want to make.
Aspirin is not for everybody.
It's not a one size
There are
fits all.
some people that should not take aspirin.
Aspirin.
There are some
Absolutely.
people that should take aspirin based on their medical history. Are you seeing it?
Yes.
Somebody that has had a stroke or has a stent should be on aspirin.
I'm actually happy you have said this because people just believe that aspirin is a blood thinner.
It's a blood
and
thinner.
they must be on
Yes.
aspirin.
In fact, some of
that
them.
was what I wanted you to debunk.
See,
Okay,
Dr.
okay,
Martina,
yes.
Dr. Wosi, the truth is that a number of people, and I like the fact that we are nipping this on board because people just go over the counter and just assume that it's a blood thinner, and they've heard that if you take it, it will prevent a cardiac arrest. So they have been taking it, no prescription, and they are even to your face with so much audacity. It's low dose, it's just 75 milligrams. 10 years they've been taking aspirin.
Aspirin is not for everybody. It should
Good,
not
we are saying
just
this.
like in Nigeria, you can get any antibiotics on your own without
Which is quite
prescription.
sad.
So aspirin is not for everybody.
everybody.
Let your doctor advise you. There are some people that need to be on aspirin.
Yeah.
Okay. So to go into who will be on aspirin benefit and who will not benefit and this, we can't cover it in this. That's the point I'm trying to make.
Oh, great.
But before we leave this, before we use up our time, I'm trying to tell you that there are certain risk management that will make a lot of difference. For example, just to talk about lifestyle changes for hypertension is a talk by itself. So let's just quickly, even because hypertension is so common in Nigeria, when you have high blood pressure, the first treatment for high blood pressure is not to go and take drugs.
Exactly.
Okay? You should know certain lifestyle changes that by doing it, you can decrease their blood pressure by 15 points. And if your blood pressure is still very high, then you can now add medication. And people with serious hypertension will even need 3 or 4 medication as their maximum dose, including lifestyle. So lifestyle changes, salt.
Okay.
Eating salted, too much salt will increase their blood pressure. Salt should be removed, decreased. Okay. Number 2 is vegetables. People with low potassium have high blood pressure. And the best source of potassium is fruit and vegetables. So if you cut off salt, you can decrease your blood pressure by 4 points. If you eat 2 good servings of vegetables every day and correct your potassium, you can decrease your blood pressure by 3 to 4 points. Are you getting it?
Sure.
Obesity. If you lose 1 kg, you can drop your blood pressure by 1 millimeter. So can you imagine people that need to lose 5 to 10 kg? They are dropping their blood pressure by 5 to 10 points.
Awesome.
You see, it's adding up.
Yes.
So when you now have regular, moderate intensity exercise, at least 150 minutes a week, but do more if you can, because the more the better. And go a little fast so that you can increase your heart rate a little bit. You don't have to run to get the benefit.
Brisk walk.
Brisk walk. If you do that, 150 minutes a week, it could be 50 minutes 3 times a week, but I would say do 45 minutes, 5 to 7 times a week. Exercise can do wonders. It's going to bring down your blood pressure. It's going to help your weight. It's going to make it easier for you to sleep. It's going to decrease your cholesterol. It's going to protect you from heart attack. Exercise is cardioprotective. Okay? So, and then if you now sleep, okay, try to manage your stress. Some people are just 24 hours of stress. Okay, they think about yesterday, they think about tomorrow. Why don't you forget yesterday and tomorrow and focus today?
on the present.
If you can do that and meditate, okay, and think of things that are good, all right? Reject anything that is bad. Just focus on the things that are good. You find out that all those things help. So if you have mild high blood pressure, let's say 140 or stage 2, if you do all these things, you won't even need medicine.
Medication, yeah, you're right.
And if your blood pressure is 200 and you do all these things and drop it by 20, then you're going to end up with less medication to control it.
Awesome.
So this is the message.
Wow.
Lifestyle changes. And guess what? All these things we have mentioned today will help your blood sugar. So if you have diabetes and you do all this, it's helping. If you have high cholesterol, it's helping.
Help, yeah.
If you're obese, it's helping.
Help. Even
Stress,
mental illness.
is helping.
Yeah.
So this is the secret.
Yeah.
And it does not cost any money. It just requires discipline. So we're talking about knowledge and experience. So some people have knowledge, they don't put it to work. So no experience. So this is what you call philosophy. Okay? Now, some people have experience, they don't have knowledge. That's ignorance. But we need the two. Knowledge and experience.
Thank you very much, Dr. NWOSU. Wow. We need it too. Knowledge and experience. It's been actually a very, very, very interesting ride having you talk about this particular topic, sudden cardiovascular death, the risk factors, and of course the presentation. I'm sure our audience actually have benefited so much from this. If nothing else, knowledge and experience they have take away from it. And of course the things that they also need to do, the prevention, the simple word prevention, that is what we would always advocate. So I want to say thank you again for coming on our program. And of course, be rest assured that we'll see Collie again. Yes. Come and talk about another very, very interesting topic that has to do with the heart. I appreciate you. Welcome. So as our viewers out there, I just want to say thank you for being part of our program today. You've heard all that Dr. NWOSU has said. You can see that he's actually an encyclopedia when it comes to anything that has to do with the heart. He's a cardiologist. Well, prevention, they always say, is better than cure. Know your numbers, try as much as possible to exercise. And I won't miss this opportunity to also remind you of the benefits of exercising, because we always say it, and I will continue to say it. If we put the benefits of exercising as a pill, we put the benefits in a pill, it will be the best sold pill in the world. On that note, I want to say thank you again for keeping the day with us. My name is Dr. Martina Agberian.
Thank you very much, Dr. NWOSU. This was a very soul-lifting, enlightening, and I'm sure our audience thoroughly enjoyed it. So for all our audience out there, always keep a date with us. You know, we bring the very best to you, because on this show, The Physicians, we are promoting disinformation and misinformation when it comes to you. Health matters. And be kind enough to follow us on all our various social media platforms. You've heard all the preventive measures. Sleep. Don't look at it as it's laziness. It's not laziness. Exercise, right? Eat fruits and vegetables. You know, just ensure that these are the things, because when it comes to sudden cardiac arrest or death, there's no symptoms. So it just happens. But if you do all these preventive measures, you are better off. My name is Dr. Memuna Yusuf Kadri. Until next time, remain blessed.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite Nutritional Supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.